Good morning, everybody. Welcome to Dr. Tom's Tips Case of the Week. Today is May 11th. Holy cow, May 11th. Can you believe that? So, during Dr. Tom's Tips Case of the Week, we cover specific things that people are asking and issues that people are facing. One of the things we've heard are that extractions can be very, very stressful sometimes. And what Dr. Tom is going to take us through today is how Ice-Lite can help reduce some of that stress. Good morning, Dr. Hirsch. How the heck
Hey, good morning, everybody. Thanks for being here today. We're just going to talk a little bit about extractions, about Ice-Lite and how Ice-Lite can be helpful for you in an extraction. One of the biggest reasons that I use it is for protection, for ease of mind and for protection. We've all had the experience of something popping down towards the back of the throat, and then we'd say, oh, don't move, don't swallow, don't do this, don't do that, because you've got something that's in the back of the throat, close to the airway. It can be a piece of tooth, it can be a tooth, it can be a burr, it can be any number of different things, but it really creates a stressful time in your life and at that moment. And I've been unfortunate enough to have people swallow things. I actually had somebody swallow. If you look at this particular bridge, I actually had somebody swallow a 3-unit cantilever bridge just like that because I wasn't utilizing Ice-Lite. And it wasn't in an extraction that happened. It was just me removing a temporary bridge. I mean, it went down the hatch. I will share that with you another day. It's a good story to share. But today we're just going to talk about utilizing, or why I would utilize the Ice-Lite when I'm doing an extraction. Well, first of all, the first reason that I utilize this is for safety. I want everything to be safe. I want the patient's throat to be protected. So what's the first thing that I do that I'm doing this is I want to pick out the largest size mouthpiece that I can possibly use to fit in there to adequately go up into the roof of the mouth or down into the lingual vestibule to make certain that nothing goes by there. And I will take one and I will take an oversized mouthpiece and I will actually trim it so it contours it just perfectly. And sometimes I will over trim it, or if there's a gap, or if there's a certain type of anatomy that doesn't give me a great seal, such as the palate right here. If I didn't have a great seal, what would I do about it? I take a cotton roll, I take a gauze square, and I would put that gauze square and that cotton roll up in the palatal vault just to seal it off to make sure that nothing goes down. But what you can see here in this picture is me going in there, just separating the periodontal membrane, and now I'm taking an elevator. And this is really a very simple extraction, but you can see that there's just plenty of room for me to get in there to extract that particular tooth. So once I've got the Ice-Lite in there, what do? I focus on my procedure. I just kind of relax and I just kind of focus on what I'm doing. Take my time. I don't have to worry about the tongue getting in the way and actually going up there and exploring everything all the time. It's just out of the way of my instrument, so it's not going to get cut. And the throat is protected. So just in this aspect, you can see there that, as I said, it was a very, very simple extraction that we did here. It came out very easily, but the nice thing about it was the tongue wasn't up there. My assistant, all she had to do is just be there and aspirate. She didn't, and she's retracting the cheek, by the way. And the reason I've got her retracting the cheek is just for visibility, so we can get a better camera view right here. But normally she would not be retracting the cheek. She'd be just concentrating on other things. And it makes it very easy. And so once again, as we're going in here, put a little Paradex up in that area just to sterilize the socket, pack that in, get it in there really nice and clean. And the great thing about this is that even the Paradex, if there's any Paradex that leaks out from that gauze square, it's evacuated up by the Ice-Lite. So you've got this nice, well-lit, well-isolated field that we can work in. And next thing, I'm just going to do a quick little grafting procedure in there. I'm just going to take a little graft after get all the granulation tissue cleaned out. Just go in there. We'll take a little Colla plug or an Osteogen plug, plug it up in there, graft it, then suture it. Those little plugs right there are kind of cool. They're Osteogen plugs. You can actually take that thing and it's made out of bovine bone. You can actually take that, and if you have multiple rooted teeth, you can actually section that like a trifurcation. So you have 3 roots, and you can put each one of those little plugs right up there in the trifurcation. And just notice how well isolated this area is. Nothing gets in my way. I focus on what I'm doing.
And it looks like your patient is comfortable and their mouth is open.
She's just relaxed. Oh yeah, the other thing that I do is I just tell her to bite down on the mouthpiece and relax while she's there. So she's actually just closed down on the mouthpiece. She's relaxing. There's no stress. There's no strain for her, which is really nice. And for me, you know, as I'm suturing right there, the tongue's not in my way.
Right.
And everything it's an easy procedure. It's nice when things are easy. It's nice when you don't have worry. Another thing that's important to do is at the end of the procedure, when we take this out of the mouth, see it can be kind of gummed up with blood. The mouthpiece can be. We don't worry about that because we're going to throw that away. But the rest of your system, you want to flush this down, especially if this is going to be a long procedure. If it's a long procedure, you want to make sure that you're monitoring the isolite so that you can turn the vacuum off or turn the vacuum down, because you don't want to over dry the tissue. And sometimes with the isolite, we can certainly, if we've got the high-speed evacuator going, full bore, we can over dry the tissue. Another thing that's fun here that's important to know is with the isolite, we have dual vacuum controls. We have 2 levers, one on the top and one on the bottom, so that we can direct the vacuuming to exactly the area of the mouth that we want. Here in this one, I had the lower vacuum channel turned off. I had the upper vacuum channel turned on because everything was flowing down to the retromolar pad. And pause that when it comes out right there. So when it comes out right there, you can just see there's blood in that thing. So you've got to flush your system so it doesn't clog up, because the blood can go in there and it can form a coagulum in there. So that's just some of the other things that we need to do. And yeah, the nice thing is my dental assistant she was always anticipating my needs. She was just a step ahead of me. She didn't have to worry about aspirating until I asked her to do whatever I needed to do. Anyway, so that's just kind of how we use this in protection. Peace of mind and safety. It's really nice not to worry about something falling down somebody's throat.
And if you look at it, it sounds like this was a straightforward case, and that's tooth number 50. A lot of people have issues, or sometimes one of the pieces of feedback we get is they have difficulty getting into the 2nd and 3rd molars. So any advice that you would give people with regard to that?
Yeah, when you're back there, let's say you're taking out number 16, if that was 16. When you go back there and you look at this thing, put the isolite up into the hamular notch, right back behind the tuberosity. It's back there. Now, right there is fine. See, it's up in the tuberosity. It's in the hamular notch behind the tuberosity. So you've got great working room. So you just got to position the mouthpiece properly to give you the working room that you need. So you've got room for all of your instruments. If you need you don't want them necessarily open too wide or too narrow. And sometimes you got to have them closed down a bit so that you can get your elevator in there.
There you go. Right. Yeah. Awesome. I love how when you use it, it just makes things easier. It's a lot less stressful. I love the message you have around that, and your patient is comfortable. So there you have it. Awesome. Yeah. Any additional final words of advice for today?
No, just have fun. Do what you do. Do what you've learned. Sit back, relax, and get the job done.
Awesome. Well, first of all, thank you so much for doing this. Really appreciate it. Those of you who like this, if you like it, please share it. If you have questions for us or would like to see other procedures done with Dr. Hirsch and the isolite, please send those over to us. Going forward, we're going to be covering a whole host of different things and addressing some of the problems that people are telling us about it. So thank you so much, Dr. Hirsch. This is awesome.
So maybe next week I'll have to tell you about the 3-unit bridge that I dropped down the patient's throat. This is actually quite a fun story, and I know we've run out of time today, so I'm not going to go into it. But you talk about a nightmare. That was a nightmare. Been there, done that. Don't ever want to go back and do that again.
Awesome. Thank you so much. Have a great week. Thank you, folks, for joining us. We will see you next week on Dr. Tom's Tips Case of the Week. Appreciate it.
Bye, everybody.